I'm going to be focusing on economic inequality itself and its role in shaping children's health and well-being and life chances. And I was just thinking back last night to the first time I came to an INRICH conference, which was the second, and we're now on the 15th annual workshop. I came to the second workshop in Warwick in 2009. I had a look at some of the pictures from that online last night. Everybody looked a lot younger, with the possible exception of Nick, who never changes, really, always looks his wonderful self. But there we all were. And I had been invited to come to INRICH to talk about the impact of income inequality on children. And I'm here again to talk to you about exactly the same thing, sadly. What I was talking about then was an analysis that we had done following the publication of the first UNICEF report on child well-being in rich countries. And that first report was published in 2007. Some of you will remember it very well. It made a big noise in the UK because we came bottom of that index of child well-being, just below the United States. Spoiler alert, that's the only time you'll see us that way around. In everything else I'm going to show you, the United States will have reasserted its position at the bottom of all charts. But in that one, United Kingdom came bottom. The UNICEF Index of Child Wellbeing that they'd constructed contained 40 different elements of children's well-being in 6 different dimensions. It was everything from whether there were books at home, to how well children got on with their families, to whether they'd been vaccinated, 40 different elements. The UK did particularly badly on our young people finding their peers kind and helpful, on teenage pregnancy, on our children having sex before the age of 15, and on drunkenness. And in that report, the Netherlands came top. And this was produced by the INRICH Research Centre, including by colleagues of mine from the University of York, Jonathan Bradshaw and Dominic Richardson. So we took that index of child well-being, removed the child poverty rate from it because that's so intimately related to inequality that we thought that would create a sort of circularity, and plotted that index of child well-being against a measure of income inequality, the gap between the richest 28% in the population and the bottom 20%. And we published this chart in the British Medical Journal in 2009, and it shows a strong and significant association between higher levels of income inequality and worse performance on that index of child well-being. And take a look at those countries on the right-hand side. You've got US, UK, Israel, New Zealand, Australia, Portugal, sort of the most unequal set with low levels of child well-being. Now we thought, and I suppose everybody here at this conference thought, that producing this kind of research is a part of what we do to create action and change. We included this graph in our 2009 book, The Spirit Level, which was a full analysis of the impact of inequality on a wide range of health and social problems in rich countries and across the 50 US states. And we hoped, of course, that that would lead to change, that it would lead to a recognition that inequality was bad for health and well-being for children and adults. But unfortunately, our timing was poor. Our book was published just as in the UK, New Labour came to the end of its period in government, when it was actually managing to reduce child and pensioner poverty and poverty among disabled people, where it was actually managing to improve things educationally for young people, but it hadn't done anything to reduce the high levels of inequality created under Thatcher's government, that big rise in income inequality that Dave referred to. And in 2010, we got a new government, and one that was singularly uninterested in doing anything to tackle that level of inequality. We also looked at child wellbeing and income inequality across the US states, and this is just a reminder of that position. That picture there, that's a similar index of child wellbeing in relation to levels of income inequality in US states. Again, the more unequal ones on the right-hand side with worse levels of child well-being. And so time passed. In 2013, UNICEF did it again. They produced a new index of child well-being, and we once again related that to a measure of income inequality. And there is the same picture. So we've still got the USA and the UK and Portugal and Australia down at the sort of unequal end, and New Zealand being joined by Italy and Greece as well. And because we'd now got these two different child well-being measures at different periods of time, we were able to look at changes in that index in relation to changes in inequality over about a decade. And we found that the countries that had become a little bit more equal, and none of them had become a lot more equal, but some of them had become a little bit more equal on the left-hand side of the graph, they tended to have better child wellbeing scores in 2013 than they had done in 2007. And those countries that became a bit more unequal on the right-hand side of the graph tended to have a lower level of child well-being than they had had about a decade previously. And UNICEF kept going. In 2016, they produced another report. This one has the line going in the opposite direction because they've got lower child well-being at the bottom of the graph rather than at the top of the graph on the y-axis. But there's the US amongst the most unequal, and I've lost track of the UK, but the Netherlands near the top again, Finland, Norway, Denmark, and the Scandinavian countries. A few more Eastern European countries included here, and so the US isn't at the very bottom anymore, but the same overall picture. And this is a graph that we will be publishing. Well, we thought we would publish it right at the beginning of July, but that looks as if it's now going to be a little bit delayed because we're going to have a general election on July the 4th. And lots of events disrupted by that, but that's not a bad thing. This graph is looking at the newest 2020 measure of child wellbeing from UNICEF in relation to a much more recent measure of income inequality as well. So this is a 15-year update on that very first chart, linking income inequality to UNICEF measures of child well-being. 15 years and really nothing has changed. Look down at that bottom right-hand corner. You've still got the USA and New Zealand and Israel and the UK. Look at the top and you've still got the Netherlands and the Scandinavian countries doing much better. So it's a depressing picture, really. This dimension doesn't have 40 indicators. It has 6 variables instead of 40. I think as much as anything, that is to do with the fact that global financial crisis, economic constraints, cuts to charities, cuts to research institutes means that we have fewer surveys producing data that we can include in international comparable analyses. So here's the new dimensions of child well-being based on 6 variables rather than 40. The dimensions are 3. One is mental well-being, and that includes 2 indicators, life satisfaction and the child suicide rate. The second dimension is physical well-being, and that includes the proportion of children in each country who are overweight and the child mortality rate. And then it has a third dimension called skills well-being, and that includes the percentage of young people in each country who are lacking basic maths and reading scores at the age of 15. And it also includes a measure of how children find it, what proportion of children find it difficult to make friends. So we've got a sort of psychosocial soft skill in there, as well as the harder basic skills of maths and reading capacity. But slightly different kind of index, exactly the same picture in relation to income inequality. And we're finding that children are affected by inequality sort of across the board. It's a very wide range of different indicators. And I'm just pulling out a few statistics here to highlight the impact on children's health, on their life chances, and on society as a whole. So if we just look at health, in the US, more than 40% of children are overweight. In Belgium and Sweden, it's fewer than a quarter. And that is a relationship shaped by inequality. For infant mortality, we've seen a sustained and unprecedented rise in infant mortality in recent years. I think that is a quote from David Taylor Robinson, who is on this call. A shocking reversal of progress in the later part of the 20th century. In education, if we look at that measure that I just talked about of lacking basic skills in maths and reading, in Israel, about half of young people lack those skills. In Finland, it's more like 20%. So again, big differences between rich market democracies related to their level of inequality. We've also looked at educational inequality itself, so the gap in educational attainment between wealthy, affluent young people and poor children. Educational inequality is linked to income inequality, and it's particularly marked for maths proficiency. UNICEF have also given us some data on parity of spending, how much spending goes towards early years education related to how large the proportion of children are who are in those early years. So if you've got a third of your child population in the early years, you should be spending about a third of your public spending on those children. That is more likely to happen in more equal societies, and in more unequal societies, early childhood spending is being constrained, and there is not parity of spending. And then we've looked at social mobility using an index from the World Economic Forum that uses lots and lots of different components. And social mobility is highest in the more equal societies: Denmark, Norway, Sweden, and Finland. Dave suggested that perhaps to live in a country whose GDP is going to be least affected by climate, you might want to go to Iceland. I think you could add Denmark, Norway, Sweden, and Finland into that list if you want to do the best for your children. This graph, and I think this might be my last graph. Yeah, this is our updated, newest index of health, social, and environmental problems in relation to income inequality, which came out in Nature earlier this year. And 15 years ago, our work was very much focused on health and social problems, but it now seems absolutely crucial, if you're thinking about the health and well-being of people, to be thinking about the health and well-being of planet as well. So we have added environmental indicators to our index of problems, so that it's now health, social, and environmental problems, and not just health and social problems. And those environmental indicators include the carbon emissions of the rich in each country, the level of air pollution, the amount of recycling that is happening, progress towards the United Nations Sustainable Development Goals, and a measure of multilateralism. And that includes whether or not countries sign up to and comply with international agreements, such as those proposed by the UN, and whether or not they are engaged in war and conflict with other countries. So if we're thinking about the health and well-being of our children now and in the future, I think we do need to be thinking about the environment just as much as we're thinking about health and social problems. And inequality is creating environmental problems through its effect on overconsumption and consumerism, and through its effect on diminishing social cohesion, reducing trust, and reducing our capacity to act together, and also through its impact on democracy. And we have found that income inequality is associated with the World Economic Forum's democracy index as well. So inequality is a barrier to tackling all of the problems of climate change and the environment. And it's also making those problems worse. So tackling inequality is not only going to improve the health and the social well-being of societies, it is likely to improve the environment as well and make it more possible for us to be able to deal with many of the big problems that are facing us. And if we're thinking about a just transition, transformation to a new reality, then we do all need to feel that we're in this together and that the transition is a fair one. And so again, tackling inequality is right at the heart of tackling the environmental crisis. So in the past 15 years since I've been coming to INRICH, my own country, as Dave so eloquently outlined, has suffered. Poverty is rising. At the cost of living crisis, at height of the cost of living crisis, 300,000 children fell into absolute poverty in a single year in the UK. These are statistics that are shocking and astonishing to me, particularly when we consider the fact that inaction on child poverty is costing our economy £16 billion a year. And last year, we brought data to INRICH from our report, Child of the North, where we had included an estimate of the mental health cost of the pandemic for children in the North. And we found that that would be £13.2 billion in lost wages over the lifetime of those children in the North. So the costs of just one impact of inequality are enormous. And if you add them all up, you know, we're talking about fantastical numbers that mean we absolutely can afford, as Dave said, to do what we want to tackle the problem. During that decade and a half, we've seen services absolutely decimated. We have a 2-child benefit limit in the UK, which has put 300,000 more children into poverty. We don't make it easy for children who are poor to necessarily access free school meals. 900,000 poor children in the UK miss out on those. And we've seen 1,300 Sure Start centres, which supported families and children in the most deprived areas in particular, have been closed in that decade and a half. So the journey of the UK's children over the past 15 years has been a really tough one. My journey as a researcher, I think, has been equally tough because I think at times it's very difficult to maintain hope and optimism that the work that we're doing is going to have a change. But we do need to keep trying to have that political impact that was raised in the discussion section. We have a new book coming out, which will actually be out now. It's been decided will come out before the general election in the UK. There's a chapter in that book on children written by myself and David Taylor Robinson. There's a QR code on the screen, and that will take you to a link to be able to pre-order that book. But this is a manifesto for a new government focused on structural change that would change the structure of the economy to create well-being. That's its purpose. It calls for things like a basic income policy, equality impact assessments of all new policies, future generations acts for England. There is one in Wales already, and they're thinking about it in Scotland. But really sort of thinking about transformative, major changes. Silvana asked a question about whether or not these thoughts are sort of utopian, whether it's utopian to strive for a completely different sort of society for our children. And I think my answer to that is maybe yes, but that doesn't mean I don't want to strive for that. And I think for us as health professionals and researchers, this is what we need to be thinking about. We all know that we need structural change for child well-being. And so that's where we need to be focusing our efforts. Now, those three policies on that screen, they might not be your top three. They're the top three of the collective that is writing that book. In our new spirit level report, I think we're going to focus much more on a permanent wealth tax as a top solution, like Dave mentioned, but also investment in universal basic services, a complete transformation of social security, investment in community wealth building, and support for co-ops, employee ownership, and mutuals, etc. So we all might have sort of slightly different take on what the structural changes are needed, what order they might happen in, how they might be paid for. But I do think this is where I need to be focusing my time if I want to do the most that I can for children's health now and in the future. And I'll finish with the quote that you will all know from Rudolf Virchow from 1848, that politics is nothing else but medicine on a large scale. We in the UK are getting a chance to have a change of government in about a month's time. And so I will be intensively campaigning to make sure that we do get that change, but also that when we do have a new government, that child well-being and child health will be high on their priority list, and that tackling inequality will be high among the things that they think they ought to be doing. And if that means making a nuisance of myself, I guess that's what I'm going to be doing for the next 15 years. So I'll see you all again in 15 years' time, and maybe there'll be some change by then. Thanks very much. Just a few links there if anybody wants to follow up. Thank you so much.
Thank you, Kate. You cannot see, but you got a standing ovation.
I did see, it was lovely. Thank you, everybody.
So thank you for that talk and those inspirational words. We're really very fortunate to have you here to share some of the new data and to hear about what's going to be happening during the next election. We're going to take a few minutes for questions and exchanges. Please raise your hand if you have a question or comment over here. And please do name yourself because Kate cannot see you.
Hi, everybody. I'm Sharon Goldfeld from Melbourne in Australia. And Kate, lovely to see you, if not virtually. I'll give you a virtual hug as well. But I wanted to ask you a question around the kind of both the cognitive dissonance and the opportunities that happened during COVID. So, and I wonder if you think the politics might have changed. So if I think about what happened during COVID and the fact that certainly in Australia, we gave money to people, like we had a conservative government that gave money to people. We, did our telehealth rollout. Instead of 10 years, it was in 2 weeks. We created a vaccine in a year. Never before in science had that ever been done. So there was this kind of opportunity, I think, which everyone took, which is to do everything pretty radically different. And I feel the politics have changed from what we can and cannot do to what we will and will not do, because it's quite clear that we can actually do many things from a policy point of view that would make the lives of children much better. And I wonder if you think, and I guess particularly in the UK with the new government coming in, and I know that we've all seen new governments not do things as well. But I wonder if you think the lessons of COVID have given us some sense that we can push governments to do things differently, or do you think that the world has just returned to its previous patterns and we're just kind of back to where we were? So I guess I'm looking for your view on what level of optimism, if any, you think COVID might have given us, as well as the adverse impacts, obviously, that Dave already talked about.
Thanks, Sharon. So lovely to see you. Thank you for the virtual hug. It is returned. I think that's a really difficult question. I think that some of the things that happened during COVID, particularly things like governments giving money to people to support them through an unprecedented crisis, should have changed our capacity to think about that as a policy more than it seems to have actually done. And perhaps some of that was language. So in the UK, we basically got a basic income during COVID. We got the government handing out to people who were employed 80% of their usual wage, with separate amounts made available for those who were self-employed, and separate support for business. And it was called furlough. And if only it had actually been called, I don't know, any kind of income, I think we would be better placed now to be able to say, look, we had that kind of basic income then, we could have that kind of basic income again. So I think because we used particular words at particular times, it's not made it as easy as it could for us to perhaps continue to talk about some of those policies. And I think my main response to your question is it's a bit too early to tell. It looks like we will have a change of government. And God, I hope I'm not wrong about that. Even though I'm wrong about every other political kind of pronouncement I've made over the past 15 years. I got them wrong. But I think we're going to get a change of government this time. But I'm not actually seeing a difference in the way that our most likely next government ministers are talking about the things that all of us here at this conference know need to change. They're not talking about the need to have an alternative to pursuit of economic growth. They're not talking about a complete radical transformation of the social security system. They're not talking about Keynesian economics. They're not talking about modern monetary theory. They're not talking about learning the lessons of the pandemic and the global financial crisis explicitly. It's all pretty much business as usual. And the only things on which we see, I think, a real strong commitment are around the health service. And I do think that will be a positive change. But I think all of the things that you and I and everybody at this workshop think are the most important things to do, I'm not hearing those discussed in any with any strong sense of commitment. And so what I'm forced to hope is that everybody's keeping their powder dry. Everybody's trying to just make sure that they clinch that election, that they don't want to frighten the electorate, etc. And so nobody's giving us a utopian vision. Nobody's even giving us a sort of pale imitation of a utopian vision. We are just really being told that it will be back to business as usual, but safer and a bit nicer. So I think there's going to be a big job to do when we get a new government. And of course, in many of the countries where you are all from, that's going to be potentially even harder, or you're going to have to wait even longer to do it. But that's what I think we all need to be doing with a strong collective voice.
We'll take one short question from Hein and a short answer in the interest of time. So Hein.
Okay, Kate, thank you for this call for action or call for becoming activist, maybe. David focused on the poverty and you focus on the income inequality. They are two sides of the same coin, but could you elaborate maybe what is the importance of the income inequality compared to poverty?
Sure. Well, I mean, income inequality affects the whole of society. Well, poverty affects the whole of society too, but it's perhaps a little more widespread. So income inequality changes relationships between people in society. It changes the nature of the social structure. So I think what I often say is if you think of society as a ladder, a social class structured ladder or an income structured ladder or an education structured ladder, in more unequal societies, that ladder is steeper and the rungs are further apart. So the material differences between us are greater, the psychological differences between us are greater, the social distances between us are greater. And that affects everybody right the way up the social gradient. So those who are just below the top are affected by income inequality, not as much as those at the very bottom, but they are. Those in the top 10%, top 20%, they are as well. So income inequality is like a sort of, it's more like air pollution affecting the whole of society than perhaps a polluted river, which is only affecting those who live closer to it. So I'm not saying that poverty doesn't affect the population. It certainly affects the economy and it certainly affects sort of things like productivity over time. But income inequality is a sort of pervasive, toxic impact on everybody in society, whether they are rich or poor. But you're right, they're two sides of the same coin. They both matter. They both need to be tackled. And they both need to be tackled for the reasons of ensuring the well-being of both people and planet. And so that's really critical. And if you think you can tackle climate change and environmental problems without dealing with inequality, sadly mistaken. You know, you're not going to get the popular buy-in. You're not going to get the social cohesion necessary to push that through. And you're not going to be able to tackle the massively imbalanced carbon emissions of the rich. So inequality is something that must be tackled, not just poverty. They both need to be addressed.